Thank you for listening to the IPN Prevention Services Overview webinar. Today is July 7th, and this webinar is going to run for approximately 30 to 45 minutes and really is intended to give a broad overview of SFY 22 work and services as it relates to the IPN prevention expectations. My name is Katie B. I work at the Iowa Department of Public Health as a prevention consultant within the Bureau of Substance Abuse, and I work alongside Julie Hibben, who is the prevention lead for our Bureau of Substance Abuse on the Integrated Provider Network grant. So the purpose of today's webinar really is to take a deeper dive into the Prevention Services Orientation Guide for year 3 of the IPN grant. To kind of kickstart today's webinar, just wanted to highlight 3 really important topics. First is that IPN prevention contractors must use the information listed in the Prevention Services Orientation Guide, the June 2021 edition during year 3 of the project. So as you are all familiar with, IDPH has established this Prevention Services Orientation Guide system, which really is the playbook for the upcoming contract year. And the intent of that is to really make sure that there's clear communication about the expectations of the grant, and really to kind of set the stage of all of the good work and services that are going to be taking place over the next 12 months. In addition, IPN contractors must submit the Strategic Prevention Framework deliverables in accordance with the guidelines established within the guide. And what we'll be talking about today is we're going to be moving and transitioning into the planning and implementation steps of the SPIF. And then lastly, primary prevention services through the IPN grant, they represent and align with the block grant requirements from the Substance Abuse and Mental Health Services Administration, or SAMHSA. So since the beginning of this project back in January of 2019, we've really highlighted the importance of providing direct service hours, providing prevention services across the lifespan, collecting data to show the really good outcomes that are being achieved through prevention services throughout the state, utilizing the Center for Substance Abuse Prevention Strategies to guide our services, and really, again, the foundation of using the SPIF to guide our work and services. So we'll continue to use the block grant required work and services. We'll continue to educate and inform you all about prevention theory and prevention science. And we'll hopefully be building on that over the next couple of months and years as we continue to build on IPN prevention services. So over the course of this webinar, we are going to be following the following agenda, and we're going to be talking about the Prevention Specialist Certification Expectations, so the CPS certification. We're going to be talking about prevention services, again, impacted by COVID-19. This year is likely going to look different than last year as we as a state are continuing to move forward, based on the impact that COVID-19 had on our work and services. We're going to be talking about project staffing and coalition engagement. We'll also highlight the Strategic Prevention Framework, data entry, and then we'll wrap up with allocated staff time and CSAP strategies, the FY22 IPN contract suspension process, prevention trainings and grant meetings, and lastly, IPN grant approved services. So we're going to kick it off today with the Prevention Specialist Certification. And again, what IDPH has been doing is, in addition to the Prevention Services Orientation Guides, we've been providing a recorded webinar in tandem to that, just because it's a lot of information to kind of absorb and understand, and we completely recognize that. So this is just a nice complement to help reinforce the information within the actual guide. If anything shared during today's webinar still seems unclear or you need additional guidance, please don't hesitate to reach out to Julie Hibben and myself via the IPN Help Desk, and we're happy to walk you through kind of the expectations and guidance set forth. So for the prevention specialist certification, we want all agencies, all IPN prevention agencies, to continue uploading a copy of the CPS certification for all current staff within the personnel component of iowagrants.gov. So what that means is that if and when your prevention specialist obtains their CPS certification, simply notify us via Iowa Grants correspondence to unlock the personnel component so that you as a prevention lead can upload that CPS certification for documentation purposes. So why this is important is per the RFP, the request for proposal, all direct services or direct service prevention staff and prevention supervisors, they are required to obtain their certified prevention specialist certification within 18 months of the IPN grant start date, or at that point in time by June 30th, 2020. So that was the original language listed within the request for proposal. Now that we're going into year 3 of this project, any prevention staff that are not yet hired, the goal really should be to obtain that certification within 18 months of the date of hire. So that really could be a really good onboarding discussion to have with staff when it comes to expectations for certification within the prevention workforce, and really have a strong strategic process for how to get all of the requirements leading up to certification met. So we understand, especially lessons learned from last year, that 18 months may be a barrier for some. And in the instance that it's really unrealistic that there's going to be, that a staff member is going to achieve that CPS certification within 18 months, we just want to remind everyone that as a prevention lead, please submit an IPN exception request to the department for us to review and look at kind of the details of why there was a barrier and why the request is being made. But in a nutshell, if you're needing to have an extension for that 18 months from the date of hire to obtain the certification, simply fill out and send an IPN exception request to Julie Hibben and myself for review and anticipated approval. So we're going to move into the prevention services impacted by COVID-19. So this looks very familiar to the content that was in the FY21 Prevention Services Orientation Guide, but still really important points to highlight. So first, the decision to provide the face-to-face services is still an independent agency decision. Again, we are in a different place than we were last year, kind of right when the state was in the beginning stages, if you will, of the COVID-19 pandemic. But we still want prevention leads, prevention services staff to be talking to their agency leadership about how community-based prevention services are being provided and what those expectations are specific to where you are located within the state. In addition, IPN contractors, they are still responsible for providing prevention services at a level that will affect positive community change. And really what that means is, even though we're still learning how to kind of navigate in a world where we're impacted by COVID-19, we still need to be providing rich prevention services. And there are solutions, and we have really learned from you all over the last year on how services are continuing to move forward, even given the current landscape and situation. But just know that, again, as a requirement of the grant and a requirement of the block grant requirements, we still need to be providing those indirect and direct services within our service areas. Kind of piggybacking off of that, we have really kind of pivoted and utilized the virtual world. And so you all still can be providing virtual presentations and trainings and programs. When you do that, however, they need to be conducted in real time and not just recorded and then sent out to stakeholders to independently listen to on their own time. If you're going to be counting an actual direct service, it needs to be with a live, real-time virtual presentation, training, or program. Because of the lessons that we've learned, we still are requiring that IPN contractors have access to a web-based system in order to provide those virtual services. And then IPN prevention funds, it can cover the cost to purchase a license for those identified web-based systems. One of the examples and why, like the why behind that, is because sometimes what we've learned is that if there are free versions of a virtual platform, there may be a capacity limit on the number of stakeholders that can join. So that has been a barrier. We've also heard of like connectivity issues for some of the free services. So we really want to make sure that if we're providing a virtual service, that it's on a virtual platform that has the capacity to hold larger crowds and larger participation. But just know that IPN funds, again, could be used if your agency is needing to go in that direction to purchase the license for that identified web-based system. We just encourage your agencies to be having internal conversations with your IT department, your information technology department, to make sure that the web-based system that you're looking to utilize can be supported by your agency, and that you're engaging your internal agency staff in those discussions as well. And then lastly, if you're offering multi-session online learning opportunities, so those recurring services, then IPN contractors really need to be selecting an IDPH approved evidence-based program. And those are listed at the end of the Prevention Services Orientation Guide. Those are the same services and evidence-based programs that we've had primarily since the beginning of this project. But just please remember to use those approved services and evidence-based programs. So here we're going to be talking about project staffing. So again, if a change in key personnel has occurred, IPN contractors really need to update the personnel component in iowagrants.gov to reflect the change. There is contract language within each of the agency issued contracts that in essence, and I'm paraphrasing here, but in essence says that within that an agency needs to notify the department within 10 business days if there's been a change in staff. So we really just want to highlight that 10-day language within the contract, because we realize that turnover does happen, but it's important that the personnel listed in Iowa Grants aligns with the individuals within the budget for their salary fringe, and is in alignment with the contract language. If a change is needed, just simply send Julie Hibbett and myself, KDB, a message via correspondence in Iowa Grants, just requesting for the component to be renegotiated. It's nice within that correspondence if you can indicate the staff who is leaving or transitioning to a new role, and then the name of the new staff member who is coming in. If that position is still vacant, that's fine. Because you can just denote in the actual component in Iowa Grants to be determined just by putting TBD in that personnel component. We just want to make sure that they're as up to date as possible. So with key personnel, this is the information that we're requesting. It's the title or position that's being hired. Again, the name of the individual who is serving in that position. Again, if that is a vacant position, you can just simply put to be determined or TBD. And then a really kind of succinct sentence or two about the roles and the responsibilities that person will be responsible for, their experience and education. And then there's also a column about the credential or license number. And that's where you would put the CPS certification number, as well as have the ability to upload the actual certification for documentation purposes. So continuing with project staff, we want to again highlight the importance of updating the names of the two staff who will serve as the data coordinator or lead for prevention data entry and oversight. So this has been a process we've used for quite some time. So it's important that the same individual does not serve as the data coordinator and the data lead. Though the data coordinator / leads, they are responsible for responding to any data related questions from internal agency staff. So to kind of synthesize that, each IPN funded agency needs to identify a data coordinator and then a data lead. So it's important that your agency is, again, having conversations about who's serving in those roles. And then the prevention specialists also know who they can go to as like a first step if they have questions about how to enter their prevention data into that. Now the REDCap data collection system, if they have questions about if something is a direct service or an indirect service. So there should be an internal point person, if you will, that can really be skilled in the data piece when it comes to IPN prevention services. And again, the prevention specialists would then be responsible for going to that individual for their data related questions. And then if that individual, the data lead, needs assistance, then it's more than appropriate to reach out to the department for additional guidance. The data coordinator and leads are responsible for viewing all past data collection webinars and really becoming familiar with all evaluation guidance documents, as well as participating in evaluation trainings. Again, because that person is serving as the primary point person within your organization when it comes to IPN prevention data, it's really important that they understand all of the process and are familiar with, for example, the passive and active consent forms and survey administration and how to enter data into the REDCap data collection system, how to establish new staff into the data collection system, and looking again back at past webinars to become familiar with the guidance and then attending any future trainings that will be happening as well. So here we're going to be talking about just some coalition engagement. So we have really woven in the importance of coalition engagement through the IPN grant. And the reason for that is the strategic prevention framework is successful when you are working with community coalitions. And it's not an independent agency per se that's doing making all of the decisions and collecting the data and building the capacity, but it's really done in partnership with your local coalitions. And so that's really the impetus for why this is so important to the work and services of the IPN Prevention Grant. So we're asking that you continue to engage the prevention-focused coalition that your organization collaborated with in year 1 and year 2 of the IPN grant. We realize that there have been some barriers in some parts of the state, not all, when it came to identifying a local coalition within specific counties. And we'll continue to work with your agencies if those issues continue to arise. But we do really encourage IPN contractors to continue collaborating with the coalitions that each tobacco use prevention and control community partnership contractor works with, and attend those coalition meetings in each county where it's appropriate and applicable. Again, please reach out to Julie Hibben and myself if you have any updates or if you run into additional identified barriers related to that. We really want to make sure that those programs are collaborating and talking because the work and services, while not the same, there are some similarities. So it's really important to maximize those prevention partners at the local level. And this is one way of doing that. So please don't hesitate to reach out to us at the state if you have questions about those coalitions and the work and services that you all are providing. And we're happy to provide that technical assistance and support. And then kind of within that same context, we at the Iowa Department of Public Health are continuing to meet regularly with the Tobacco Use Prevention and Control Division, and we'll continue to do so just to learn and grow with each other as well. And we will continue offering regional community partnership and IPN virtual meetings for the near future, just to help foster those relationships and open those lines of communication. So coalitions really should represent the county and not solely one community. And really what that means is sometimes what happens is that a coalition may be meeting, for example, in like the county seat of a specific county. And while that's great, it's really important that the work and services that the coalition is working on really impacts the entire county, and it's in a county coalition and not just within one specific community in the coalition, one community within the county. And coalitions, as I mentioned before, really do play a pivotal role in supporting the strategic prevention framework through the IPN grant. We know in prevention that people support what they are a part of and what they help build and what they help create. And coalitions are a group of people that are working together to achieve the same or similar goals and outcomes. So coalition work through prevention is just vital to the success of the work and services that are provided through the grant. And again, please feel free to contact the department if additional technical assistance and support is needed. So moving into the strategic prevention framework, as I had mentioned earlier as well, in year 3, so FY22, we are going to be moving right along into the planning and implementation steps. You all have worked incredibly hard on the assessment and capacity steps, and now we really are going into planning and implementation. So within the planning guide that was shared a few months ago, there are 3 deliverables that really are the outcome of that step. And that's a logic model, a strategic plan, and an action plan. And because each of those deliverables really deserves its own webinar itself, because they're I won't say challenging deliverables, but we need to be working together with you all to train you on how to complete those deliverables so it makes sense, and helping connect those dots between the assessment step, capacity step, and then again, the deliverables set forth in planning. So what we're going to be doing is we are going to be having separate individual training webinars on each of those deliverables, really to help support you all in the important work that you're doing at the local level. And then once the planning step is completed and those deliverables have been submitted and approved, we move into implementation. And when it comes to implementation, the core essence is we're going to be utilizing the pre-approved services to support effective primary prevention services. And really it focuses on strategy selection, so making sure that we're using data-driven decisions or making data-driven decisions. There's a large focus on environmental strategy implementation. There are core components of a service that are going to be woven into the implementation step, as well as fidelity checklists, and then a focus on messaging. So we talked a little bit during the planning webinar about on July 31st, the EBP selection and implementation guide is going to be unveiled. And that really is going to be a pivotal part of the implementation step and will be utilized during the planning step as well. So here we're going to talk more about the planning step. So here we say the planning step, it's going to take place from May 2021 through December 31st. And the reason we say May is because the planning guide and the associated resources that are going to be used were provided to the IPN prevention leads on April 30th via the IPN help desk. So because we had provided the information on April 30th, it made logical sense to say the step is going to be taking place from May through December 31st. December 31st is when those deliverables are due. We realize that there's a lot of work to these deliverables, so we wanted to provide a very generous time frame of over 6 months to complete these actual deliverables and establish enough training so that you are set up for success to complete the deliverables, excuse me. So here we talk about the identified coalition and or subcommittee. Some IPN prevention contractors are using subcommittees, as well as community stakeholders need to be a part of the planning step. So as we've threaded through all of the strategic prevention framework, it's it's vital that coalitions and or subcommittees and community stakeholders are a part of each of those steps, because they will be helping and informing the planning deliverables as well. And as I mentioned just a few moments ago, recorded trainings are going to be provided to IPN contractors during this current fiscal year, and each training is going to focus on one planning step deliverable. So with the implementation steps, so once we get the planning step completed and the logic model, strategic plan, and action plan are approved, then we move into implementation. So again, just as a reminder, the EBP selection and implementation guide is near completion, and it will be provided to you all here on July 31st. And then again, just reiterating that the identified coalition subcommittee and then the community stakeholders, they also need to be a part of the implementation step, and we will work right alongside you so that we can answer any questions you might have, provide some helpful tips on how that can look, so that your communities are really a part of this process. So here we're going to talk about data entry and specifically the REDCap data collection system. So as you all know, we are really in the midst of transitioning to a new data collection system. For many years, we used the iSmart data collection system. And during this next contract year and in the future, we are going to be utilizing REDCap. So all direct service hours dedicated to both the planning and implementation steps will be entered into REDCap. IPN contractors will be using their own discretion when selecting the appropriate prevention priority area in the REDCap data collection system. And the reason that we say that is we do realize that at times when you're attending a community event, for example, you may be talking about more than one substance or one topic, but we don't collect the data that way. So just being intentional about when you're going in to provide a service, what is your goal, and think about your current work plan and what strategy that you're working under, because that will also help you when you're entering your data. So for example, if you are working under the marijuana prevention priority, for example, and you know that you're going to be going to a certain number of civic organizations or coalition meetings to talk about a specific topic, and maybe you're weaving in some of the other priorities as well, but if you're going for that specific strategy, then the primary conversation really should be on marijuana, for example. So when you're entering those data, you'd make sure to select marijuana as your prevention priority area. Again, that's just one example, but just thinking through when you're going to a community event or you're presenting on a specific topic, while there might be other subjects or topics infused into that, really what did you speak more about? And what was your intent and your outcome of that specific service, and enter that into the data collection system. And then IPN contractors must enter individual direct service as a separate service. Do not enter one large entry for all time spent on a SPIF deliverable. The reason we bring this into the slide is at the beginning, and it was a great question, at the beginning of the IPN project, when we started utilizing the strategic prevention framework and the deliverables, that was a question, was can we, if we're completing a deliverable, should we just complete the deliverable and add just one large entry for all the time spent on that deliverable into the data collection system? And the answer is no. You really need to be entering each individual direct service as a separate service in the data collection system. And then lastly, IPN contractors are going to be selecting the most appropriate available option under the community-based process strategy that best reflects the service provided. So what that means is in the REDCap data collection system, under community-based process, when that field is selected, the available choices align with the strategic prevention framework and assessing local data, building coalition capacity or stakeholder capacity for prevention services, planning, working on planning models and planning deliverables, or just simply planning prevention services with local coalitions, subcommittees, stakeholders, et cetera. So make sure when you're looking at community-based process that you're aware that the available descriptions are really aligned with the strategic prevention framework. So here we're talking about allocated staff time and the CSAP strategies. Again, prevention specialists are encouraged to allocate a certain amount of direct service hours towards the strategic prevention framework. And what we have suggested is that 50% of time is spent on the planning step, really, or other SPIF related services. And then 50% of time is dedicated to additional prevention services, whether that's indirect or direct. And the reason that this was put into the original document was really because this was a shift in how we've been doing prevention services through this funding opportunity. And we knew going into the IPN grant that there were some older services that were being provided, or historic services that were being provided, and that was perfectly fine. But we really wanted to make sure that agencies were setting their staff up for success. So they were carving out enough time to actually dedicate to the strategic prevention framework process, because the SPIF takes a lot of work. So we wanted to make sure that prevention leads and agencies were setting their staff up for success and making sure that they were balancing their time so that they were doing their due diligence for the SPIF, because the SPIF is really the foundation of the IPN grant and really needs to be the core function to make sure that the work and services that we're providing are the best fit for the counties and our service areas. And really, in essence, what this does, it ensures, again, that adequate staff time is dedicated to the SPIF to support grant objectives and ultimately achieve really good outcomes. So here we're going to talk about the CSAP strategies. So again, a block grant requirement and expectation of the SAMHSA block grant funding is that IPN contractors are expected to provide prevention services utilizing each of the Center for Substance Abuse Prevention strategies. And those are alternative activities, community-based process, education, environmental, information dissemination, and problem identification and referral. Historically, we know that a large majority of services tend to fall into usually the education and the information dissemination strategies. So doing those one-time presentations within your communities or your service areas, as well as providing recurring services, typically within a school setting, not always, but typically. And while those are important, they really should not be the only services that are provided, because all of these strategies working together really lead to healthy communities and healthy outcomes. So we're really working with organizations to make sure that you're talking as a team about how your agencies, how your prevention staff are using the CSAP strategies to support the work and services of the grant. And then just wanted to kind of talk a little bit about the direct service hours. So we've been asked questions about this as well. So while there are no set number of direct service hours to achieve within the request for proposal, IPN contractors are still responsible for providing both indirect and direct service hours. Again, that's a block grant requirement. That's an expectation of the funding. So making sure that as a prevention lead, as your prevention team members, that you're talking through what that looks like for your organization. And so again, while this is not an expectation, there's not a number to achieve per se, agencies might want to consider establishing a level of effort standard for prevention team members. And again, that's something that is really up to your organization, knowing that the expectation is that, again, both indirect and direct service hours are provided. It may be something to consider as an internal conversation at the agency level moving into this next contract year. So here we're going to talk about the FY22 IPN contract suspension process. So this language came directly from the Prevention Services Orientation Guide and reads, Governor Kim Reynolds has extended the State of Public Health Disaster Emergency Proclamation. The procurement provision in the proclamation authorized IDPH to suspend competitive selection processes and compliance with procurement-related processes if such suspension is necessary prevent, contain, or mitigate the effects of the COVID-19 virus. In light of this proclamation, the department announced in March of 2021 the FY22 request for application, or RFA, for the Integrated Provider Network grant was suspended. So what does that mean? So basically that had an impact on your prevention work plans. And in historic years, when there's a request for applications, agencies have to submit a brand new work plan with all new work and services. But because of this suspension process, this is a streamlined approach. So really you have two options to select from. But please make sure that any modifications that are made to your FY22 work plan, that please use track changes within that Word document that you submit. And that just clearly shows the changes being made, and it assists with the review process. So the first thing that could have been or can be selected is to maintain your current agency identified services. So basically what you would do then is you would slightly modify the most recent FY21 IPN Prevention Work Plan. Now, your agencies need to determine what is the most up-to-date, the most current work plan that has been approved. Some agencies had very minimal modifications over the last year, and some had more, and that's fine. But please make sure that when you do make modifications that you're using the most current or the most recent FY21 IPN Prevention Work Plan. Again, please use track changes and update the timeframes for FY22. So this one is a really streamlined approach where the work and services are staying the same. You're simply updating just the timeframe to be to reflect the current contract year. And then due to the planning step, timeframes, we're saying should reflect July 2021 through March. So the March is kind of a gray area because those spring dates are subject to change pending the approval of the planning deliverables. So what that means is once your action plan is approved, those are the work and services that you're going to be providing for the duration of the project. So there will be a transitional period this coming spring from the current work plan that you're starting at this point in time, and then when the action plan is approved, moving into those work and services. And we will continue to support you in that transition as well. So just know that when you're thinking through your work plans, that March timeframe is a little bit gray, like I said earlier, just because there will be a transitional period from your current work plan to your action plan that's approved. So just please be aware of that. And then resubmit the FY22 IPN Prevention Work Plan via the correspondence component of Iowa Grants on or before July 16th. So really, if you choose this, you're really only going to be updating the timeframes within your work plan. Once we receive the modified work plan, we will promptly review the date changes. And then once you receive approval, you can begin implementing the revised prevention services. The second option is to actually modify some of the work and services within the work plan. So this is when you would request a work plan modification. If you're wanting to do this, please request an IPN prevention work plan modification via correspondence before July 9th. So once we at the department approve the request, we ask that you revise the IPN prevention work plan and resubmit the changes via correspondence on or before July 16th. Again, please use track changes when you're making those revisions. Once we receive it, we will promptly review the modifications. And then once those work plans are approved, then you can begin providing the prevention services in your service area. We have had some questions about the SPIF related strategies within the work plan. So as a reminder, because of just this process and the suspension process, the FY21 IDPH developed work plan strategies, so any of the strategies related to the SPIF are just going to remain the same. But just know that IPN contractors are expected to continue collaborating with the county coalitions, subcommittees, stakeholders, et cetera, to complete all SPIF deliverables. So please just, even though those deliverables have been completed for the most part, just leave those IDPH developed work plan strategies related to the SPIF the same. So here we're going to talk about required trainings. So prevention staff who have successfully completed SAPS training or the substance abuse prevention skills training in the last 7 years are not required to attend again. You're more than welcome to attend again, but not required to. Training logs, we are still going to use a training log system, excuse me. So that is a way that we can document the trainings that have been fully completed. So we have provided IPN prevention leads who then are going to be sharing it with all prevention specialists funded under the IPN grant, the new training logs. So we have a training log due on January 15th of 2022. And those are for trainings that were attended from July 1st of this year through December 31st. And then the second one is going to be due on July 15th of 2022. And those are for the trainings that were attended from January 1 of 2022 through June 30th of that year. And then as you have been doing, please continue to submit those training logs to the department via the correspondence component of Iowa Grants. And then we also have just some key trainings that we want you to be aware of. So all IPN prevention trainings noted in the Prevention Services Orientation Guide, they are going to be pre-recorded and sent to IPN prevention leads via the IPN help desk. So over the next several months, you will be receiving not only this webinar on IPN Prevention Services Overview, but also we'll be having a webinar on the IDPH EBP Selection and Implementation Guide, the Planning Guide and Deliverable Deeper Dive webinar. And then this is where we're going to be really getting into the how do you do these deliverables for the planning step. So we're going to be spending an hour, if not more, talking about learning about logic models and how to actually complete that deliverable, putting the strategy and strategic plans and how to successfully engage your communities and your coalitions to develop strong strategic plans. And then lastly, we're going to be spending time on a webinar about developing strong action plans. So for FY22, for IPN grant meetings, we will continue to host virtual meetings to support IPN contractors. We will still be using the community of practice model, which has been going very well. So thank you to everyone who's been attending those and participating. Those have been just a really great use of time. We also have just want to highlight that the IPN COP meetings will continue to rotate between prevention and treatment and then a combined call each quarter. So we sent out the important dates document that has all that information included. You're more than welcome to participate in all of those calls. You don't just have to come to the prevention call because it's really great for us to learn from our peers across the continuum. And then in addition to the COP calls, we're going to be doing the 2 contractor meetings each year in FY22 as well. And those additional details will be shared when those meetings are closer. So we're wrapping up here and talking about the IDPH IPN grant approved services. So just a reminder that contractors need to be choosing prevention services from the approved list within the Prevention Services Orientation Guide. You all have been doing a very good job with that, but just wanted to make sure that you're continuing to just be aware that that list exists and that if you're making modifications to your work plan, that you're selecting from the approved list. We will only be reimbursing IPN contractors for services provided in accordance with the approved services list. So we do monitor that when we're looking at the data entry. So just please be aware, and we completely recognize, as we've talked about in some of the data collection webinars, we realize that at times in prevention, because our work is so, it involves the community so much, that our stakeholders may at times ask us to provide work and services that are outside of the scope of what we're funded to do in our work plan. And there may be times that those requests are warranted, and we have a work plan modification process, if those changes are needed. But it's really important as a prevention specialist that we also know who within our community can potentially provide the services that maybe we can't. So just make sure that you're aware of the approved work and services. If you're asked to provide a services that's not listed in your work plan, but it may be a good fit, please reach out to us, and we're happy to have those conversations with your organizations. And then in the event that maybe it's not the best fit, again, please be aware of who in your agency, or not your agency, excuse me, but who in your community might be able to fulfill that need for your community partner or stakeholder. And then also, please remember that we have an evidence-based program waiver request form and an EBP adaptation request form available. So those have been utilized for almost the last 2 years now, but still something that agencies can explore if they find a program like an EBP that maybe isn't on one of the national registries that shows really strong outcomes. We want to hear from you about what those are. So please continue to fill out those waiver request forms if you come across a program that really might be a good fit for this project. So as we conclude, I just want to thank you all for the work and the services that you have and continue to provide through the IPN Prevention Grant and the IPN Grant in general. We are so incredibly proud of the work that you all are providing. And we realize that this is a significant change, using the strategic prevention framework in the way that we are through this funding opportunity and the deliverables, but the outcomes will be incredible. So we are just thankful for what you are doing, and we really encourage you to reach out to us at IDPH if you have questions, if you want to schedule a TA call, if you just need our assistance. We are here to support you in a variety of ways. So please reach out to us via the IPN Help Desk as kind of our central location on communication for all things IPN, and we'll be happy to continue supporting your agency and your efforts at the local level. So thank you, and until next time.